Hi, I'm Leslie Edwin. I'm the president of Cushing Support and Research Foundation. We are a 501c3 nonprofit corporation that was established in 1995 in Plymouth, Massachusetts. Our founder, Louise Pace, had adrenal Cushing's. She was diagnosed in the early 90s, and throughout her journey to treatment and recovery afterwards realized there was a lot of needs that were not met in the community, namely peer support, better education for providers, better treatment options for patients, and better research and more clinical trials. Over the last quarter century, there's been a lot of medical advancements and technological advancements, but there's still a lot of work that needs to be done. Today, CSRF is run from here, Atlanta, Georgia, which is my hometown. Persistent high cortisol is extremely dangerous to the body. It causes glucose intolerance, high blood pressure, bone fractures, and a host of other conditions. The most common cause of hypercortisolemia is excess steroid use, usually for pain, allergies, and asthma. Other conditions that can cause hypercortisolemia would include chronic stress, anxiety, eating disorders, alcoholism, sleep apnea. There's several more. What we mostly focus on is endogenous Cushing's, which is caused by a tumor on the pituitary, adrenal, or elsewhere in the body, which would be an ectopic source. Endogenous Cushing's is a rare disease. It is the most difficult endocrine condition to diagnose, but the 3 gold standard tests for testing cortisol have about a 92% accuracy rate. And the Endocrine Society does have guidelines for diagnosing and treating all types of hypercortisolism, including Cushing's disease. We're here at Emory University Hospital in Atlanta, Georgia. This is actually where I was diagnosed in 2012 with Cushing's disease. I was lucky because I had specialists in a center of excellence available very close by, but most patients don't luck out that way. And so we aim to support the patients and the doctors who don't see patients, hundreds, thousands of patients in their career. It's not very likely that you're going to see many Cushing's patients in your career, but you're likely to see an increasing number of patients seeking treatment and answers for high cortisol and all of the symptoms that go along with it. We'd like to support you. We have newsletters, we have all sorts of resources. We can create resources if we don't have one that you need. We have printables if you need that. I happen to have an example right here. This is me a couple of months before my diagnosis. I waited until I was florid. I was very sick when I got diagnosed, and then by the time I had my surgery it was pretty dire. We're trying to make sure that patients don't get to that point. There's at least 30 symptoms. They're all non-specific. They include things like cognitive issues, insomnia, high blood pressure, striae, thin arms and legs, osteoporosis, odd fractures, bruising, muscle weakness. The list goes on and on. I would like to invite you to visit our website for our resources and more information about Cushing's, csrf.net. Thank you for watching our video.